Hi everyone, I want to go over the syllabus with you, but I just want to make sure you understand that this is not the exact syllabus from your class because it's not ready yet. But I want to show you some important items. So the first one is at the very top up here, you see that I have office hours. Um, the office hours will appear here, and we're going to meet in WebEx, and this is the WebEx address. This is not my office hours for the semester, but that's where you will find the office hours. This is my office phone number. If I'm not there, your voicemail becomes an email, and I do get to hear it. My cell phone number is for texting for emergencies, and we'll talk about what might constitute an emergency as we go through the syllabus. You can read the course description and rationale on your own. The required text is The Witches, Midwives, and Nurses by Einrich in English. If you are really into women's health, this is a book that you should purchase. It is about $7. It's a very small book, but it's something that if you're in women's health, you should actually have. If you don't want to buy it, there are links. There's a link here, and there's also a couple links inside Blackboard. One with an audio book that's read to you and one that's just the paper book. These are objectives that we have to meet for our major. Even if you're not in our major, these are the items that we have to review. These are the course objectives. Everything we do in the course actually addresses all 8 objectives, the way the course is laid out. Policies, and so we'll go over those. Attendance, this is an online course, so your attendance is basically counted by you submitting your work. If your work is submitted on time, you're considered present and engaged. Lateness to assignments, you lose 20% of your points for each day you're late submitting the assignment. At the end of a unit, everything's closed because once we finish a unit, it doesn't make sense for you to try to do the work in that unit because it's no longer relevant. An excused absence, and this would be important for if you're submitting work late. If you have an excused absence or an excused documented reason for something being late, it will not be marked late. And the 4 reasons why that typically we have death of immediate family, severe illness, legal obligation, or recognized religious observance. The first 3 require documentation on official letterhead. If you don't have that, then I'm not going to accept it as an excused absence or an excused lateness on an assignment. Religious holidays, I can look up myself usually. So that's the information. This is what I require on a medical note. If you can't get that, then you need to work with the Office of Student Affairs because these are the only notes that I will accept. Legal notes, it tells you what I need. Death, all deaths you work through Student Affairs. I don't accept any documents for that. They know exactly what you need. You give them what you need in Student Affairs and they send it to all your professors. So these are the ones that are approved automatically. If you think you have a special circumstance, like you have to work extra hours or something like that, you can email me and we can set up a time to talk. If you need help because you missed something because you were sick or you were at a funeral, I'm more than happy to help you. But if you need help, I'm going to ask to see your work so I can see what's going on, what you missed. I'm also going to ask you specific questions like, well, tell me where you became confused or tell me what you understood and at what point you stopped understanding. Because once I get that kind of specific information from you, I can actually help you try to clarify things you don't understand. Due dates are pretty clear. We'll look at that later. Lateness, I've already gone over. Assignment submission, I ask you to save your assignments a specific way with the course, the assignment, the year, the month, the date. And the reason I ask you to do it like this is if you do year, month, date, and you get used to it, all of your work will appear chronologically, and that's really important. All of my assignments are named in a way that they should appear alphabetically if you save them correctly. It doesn't matter to me if you use single or double space. You need to use 11 or 12 point font. These are the fonts that are acceptable because they're the easiest to read. I use APA in the health field. If you were in a major that doesn't use APA, I'm fine with you using that format. But when you submit information that's on a reference list or a bibliography, you need to tell me which style you're using. And then I'll use that style to actually grade your APA format. Also, the Writing Center can help you with citations, whether it's APA, MLA, Chicago, whatever your field uses, whatever your major uses, feel free to use that. Your participation is going to be viewed by how much you engage with the material and with each other. There's a discussion in each unit, and there's guidelines on how to work through that. You're expected to behave in a professional manner. Electronic devices, this is if you're face-to-face. Attendance face-to-face is here. We're online, so neither one of those apply. Academic integrity, I need you to review the academic integrity policy so that no one gets in trouble for breaching academic integrity. If you breach academic integrity, for me, no matter how big or small, you will be sent to the Office of Student Affairs, Student Conduct for a hearing. And you will receive a minimum of a 0 on that assignment. So these are some pieces. I will check this to make sure the link works for you. And that just goes over what I just said. This is an online class for communication. I pick up my emails at least once a day, usually early morning, Monday through Friday. I do not pick up emails on the weekend. So this would be an example of an issue that might be an emergency and why you would text me on my cell phone. So, for example, let's say that you've been called out of town because your grandmother's dying. You would email me that information, and then you would send me a text message that says, could you please read your email on the weekend, because I don't read it on the weekend. Or let's say your computer crashes. And you send me an email, my computer crashed, I can't find my work. That's not an excused absence, but we can at least try to work something out. And then you text me, please read your email. If it's a very short question, you can actually just text the question or statement. And again, the texting is for emergencies only, not just because you have a question on a Tuesday afternoon. Okay. This is the breakdown of what's happening. You have 8 online assignments that are each worth 5 points for a total of 40 or 20% of your grade. Discussion boards, there's one for each unit and one where you introduce yourself. They come to 35 points or 17.5% of your grade. In units 1, 2, and 3, there is a reflection that you complete, and the reflections are designed to help you pull together all the meaning from the unit. That's the points and the percentage. The final project will be, and we'll talk about that shortly, is worth 60 points or 30%, and your final reflection counts as your final exam, and that's 20 points or 10%. So the grades are pretty much spread out. A lot of the assignments along the way, the online assignments, are really geared to help you with this final project. The grades, the descriptions of the assignments, this discussion post, the first one is about introducing yourself to the class, and then each of the other 3, in units 1, 2, and 3, there's a discussion that requires 2 posts, and that will be described in Blackboard. The reflections I just talked about, the final reflection, and then the final project. So in this class, you have a final project because we don't have tests, and your final project is to demonstrate the amount of learning you have in a specific area. So there are no written papers allowed in this class. I will not accept a written paper as your final project, and we'll talk about what are options. So these are choices that you have about women. These are all major health issues that have been identified by the Centers for Disease Control and Prevention. If you want to do something that's not on this list, just ask, because it could be something very important that might not be one of the top 10 or 12 issues, but it's still an issue. And so these are issues you could address. And you're going to choose a format for your project. But no matter what the format is for your project, you have to address the same information. You have to address historical legal policy issues, 3 of the social determinants of health, diversity in women, and spelling, grammar, and sources. So it doesn't matter what your project is, they are all graded for the same content. So these are examples of projects that you could do. Again, these are examples. If you have another idea, I'm more than happy to listen to it. A letter to a politician or a letter to an editor, that would be your audience, your politician or your editor. Critique of current advertisements, you would pull up advertisements that depict women, and you would have to critique them using the criteria that are listed for the project. You could create a brochure on a specific topic. If you do this, you're required to choose an audience. And that's because you cannot create one brochure for all women. African American women in urban areas and Hispanic women in rural areas have different needs. Teenagers, people in their 20s, middle age, and elders, they all have different needs. So whatever your brochure is on the topic, you also have to choose a population. Slide presentation on a current issue is the same thing. You need a population. Your presentation will be about that current issue, and it will be to that population. A plan for action we can look at, or you can create a web or media advertisements or posts. And so there's advertisements like pop-up advertisements that appear in social media, or on, like if you're reading news articles online, things pop up for advertisements, so you could create those. Or you could create a web page, and the web page could be a separate web page, or it could be a social media page. And also I've had one student do a podcast, and when we get inside the assignment, you'll see that you really need to stay close to 10 minutes. So those are assignments. So you're going to choose a topic, you're going to choose a format, and you're going to choose a population. And you'll do that on one of your first assignments, and then I'll approve something for you. And that's so that there's a variety of different topics covered in the class. No individual gets extra credit. I usually give 1 extra credit assignment near the end. And because I don't give a lot of extra credit, you really need to focus on making sure your work is high quality. If there are other things that happen throughout the semester on campus or close to campus that are related to women's health, I sometimes offer those for extra credit as well. These are support services available to you. And then here, I just want to show you the outline. There's 4 units. It tells you what the unit is and when it happens. It gives you guidelines of how much time you should spend in this. And so in this timeline, you should complete lesson 1 and lesson 2. And it tells you due dates over here. Again, lesson 3 continued. Lesson 3 is big. So in the center, it tells you what to do, readings and watching. And then over here, it tells you what assignments are due. Your due time is 6 p.m. If you don't like 6 p.m., then turn it in the day before. And you can turn it in at midnight, 1 o'clock, 2 o'clock in the morning. But your assignments are due by 6, and I try to start grading them that night. Unit 2 is on social and community content and access to quality care. In this section, there's a lot of readings and videos in Blackboard. There will be required readings and videos, and there'll be recommended items. Lesson 1 is general. Lesson 2 will have links to topics that you're doing to help you find material. Lesson 3 is in general, and lesson 4 helps you find material for your project. So again, here you have the assignments that are due. Unit 3 is set up the same way. And then in Unit 4, what we do is we try to pull it all together by reviewing each other's projects. So you have a few extra days to complete and post your project. Projects are posted on May 3rd to a discussion board. Your extra credits due May 1st. During this time period from the 4th to the 15th, you're going to watch and score 8 to 10 other people's assignments or projects. You're going to score them. You're going to post questions to a certain number of people, and then you will answer questions that are asked of you. And the final exam is your final reflection. So that's an overview of the syllabus, the most important aspects. Feel free to review it and ask questions if you have any questions. I look forward to working with you this semester, and we'll talk soon online.